Hey there, it's Dr. Moz. Just want to make a short video on how to look after your scar once it's done healing through the initial stages. So this applies both to wounds and injuries as well as to procedural scars that we've created as part of your treatment. So the timing for this video to be applicable is sort of after that initial stage is complete. So if you've had stitches, usually that's when the stitches are removed. If you've had some sort of shave biopsy or curette, or you've had some sort of gravel rash or a burn, then this is usually once the skin begins to heal over again, and that's called epithelialization. There have been lots of studies looking at how to best look after scars, and there are sort of three main things that keep coming up again and again and again in the literature. So those are the three things that we'll talk about today. The first step is keep it out of the sun. So there's an adage that goes out of the sun for 2 summers, and that's probably because the more sun exposure that the scar sees, the more likely you are to have some sort of discoloration between the scar and the surrounding skin. So the more we can cover up that area, preferably with sunscreen, but even better would be with some sort of physical covering or a dressing, then the less likely you are to see pigmentation differences between the scar and the healing skin and the skin around the healing area. The second thing that's really important is some sort of silicone. So there are 2 main choices for this. You can most commonly hear me prescribe things like a silicone gel, of which there are lots of different brands. Stratamed, Strataderm, Bepanthen does a silicone gel as well, and there's a whole bunch of others from the pharmacy. So that's probably one of the more practical ways of using silicone, and I would probably apply that twice a day. Or alternatively, if it's practical, the best thing would actually be a silicone dressing, and I normally recommend a reusable silicone dressing. They are a little bit expensive, but they are reusable, which means you can use them again and again and again for that injury, as well as for any other future injuries or procedures. With the reusable sheet dressings, you'd actually cut it down to size, put it on the wound or area that's sort of injured, and then at the end of the day, take it off, give it a little bit of rinse with some clean water, let it air dry, and then you can put it straight back on again. There is some evidence that using silicone can improve the scar's appearance all the way up to about 3 months. So I encourage you to use it for as long as you think is practical, or as long as you think you value the importance of the scar being cosmetically appealing is to you. The third thing that we often recommend is taping. So taping is really important because often we'll take the stitches out at 1 to 2 weeks, and taping helps support the skin that's still not quite done healing. So when we take those stitches out, you're probably really only at about 25 to 30% of the eventual strength of the wound, and that improves all the way up until the 6-week mark, where it reaches about 80 to 90% of its strength. So taping becomes really important for big muscles, shoulders, backs, things that move, so joints around the wrist, around the knee, around the elbow, because it can help protect you from having something called wound stretch, where the scar stretches out and becomes quite unsightly. So even when the stitches are out, it's still probably worth taping for probably up to about 6 to 12 weeks after the stitches have been removed. Taping's less important for injuries where there hasn't been stitches used, so shave biopsies, curettes, things like that. But anything where you've had some stitches bring the skin close together, it's probably worth either talking to your doctor or just going ahead and taping for the next sort of 6 to 12 weeks. Those are the main things that I think are important when we're sort of dealing with scars. There are a bunch of other things that don't have as strong evidence, or perhaps where the evidence is good, but the cost is significantly prohibitive. And if you wanted to talk about those things, you can ask if there's anything else specific for your scar, and we can definitely talk about that. Hope this has been helpful. We'll see you next time. Take care. Bye.